let's talk about the big elephant in the room, the MCAT. Hi guys, welcome back to Allyssa the Healer, where we discuss medical school, mental health, and motivation. So today, I will be releasing the first episode of the series called GoalDiggers. I am excited to be inviting different people who will be discussing their journey to achieving their dreams. Today, we have a very special guest, one of my closest friends, Lethicia Paul, who will be discussing her journey to podiatry school. So stay tuned. If you like this content, please press the like button and subscribe. Okay, let's welcome Lethicia, aka Lettuce, to the table, to the big table.
Hi guys, thank you for having me.
Oh, thank you for coming. So I am very excited to be sharing your story on here. So the first question that I would like to ask my guests is, do you have an affirmation for today?
I think like based on what I've been asking God recently for guidance, for wisdom, my affirmation is to just trust Him and to keep working hard. That's the one that I have for today.
Okay. So let's begin and talk about your own story, okay? So first things first, why did you choose medicine? The big question.
Well, my story is a little like typical in the beginning as far as like why I picked medicine, because I grew up in a family full of medical professionals. And so I was exposed to it at a very early age. Like my mother is a pharmacist, my father is a physician, and pretty much all of my aunts, I have a lot of aunts, are nurses. Mm-hmm. So I grew up, and I also grew up loving science. I grew up seeing my father like really prioritize his patients and really enjoy going to work every day. That's something that you don't see, you know. A lot of people, they go to work and they're like, oh, I don't want to go. But like, my dad really enjoyed going to work, and just the way he talked about like how he felt when he took care of his patients. So like, that already exposed me at an early age. And I think when I started taking science classes about the human body, I also, it's not just like I want to be a doctor because my dad's a doctor. I also developed an affinity for the topic, like the topic of medicine, kept working through it. And of course, having to transition from living in Haiti to living in the United States kind of made my journey become less traditional from that point on.
You mentioned something very important that I forgot to mention. Let's tell the people how we know each other. Okay, so background story. We've known each other for, I don't know how long, decades now.
Decades?
Yes. Since we were like 6 years old.
2 decades. I would say exactly 2 decades.
Yes, exactly 2 decades.
Yeah.
Yes, we met in Haiti, at school in Haiti. We basically grew up together and all of that. And the interesting thing is that our paths have been very similar. So we moved to the States around the same time. You moved first, you moved before, but then you came back to Haiti, right, in 4th grade. And then
yes, for like 4 months.
Yeah, and then you moved to the States after the earthquake that happened in Haiti, just like me. So you told us about how you had a great example from your family and everything, but what was surprising to you when you came to the States? You know, did you expect the journey to be like it was?
That's a good question. When I came to the States, I actually did not expect for it to be like that. Because in Haiti, like, because I have an older sister who is a physician now. She went to medical school in Haiti. So like my father, he was not only a doctor in Haiti, he was also a professor at multiple medical schools. So it's like before I moved, the path was clear for me. It was like, okay, I'm gonna graduate from Sacré-Cœur, which is when we went to school, and then I'm gonna go to Notre Dame, where my sister went. So that it was just like, to me, it was clear back then. But then moving here, it's completely different. Like in Haiti, you go to med school for 7 years, In the States, you go to college for 4 years, and then you go to med school for 4 years. And then obviously there's the training years that come after that, depending on what specialty you choose. But coming here, it was kind of like I was set back to like kind of like just change my plans and figure out how it works here. And I know there's a lot of people, there's a lot of families in the United States who, when they know they're going to med school from the get-go, they start planning for that since high school, you know? Like there's like SATs, what college you go to, and in college, what med school you go to. So it's like you have all that preparation ready for you. But like coming into here, junior year of high school, and then like going to college, not even knowing how it works, having to figure it out on my own, like it definitely was not expected.
Yeah, I can relate to that, definitely. What did you do during and after college to set your path to go to medical school?
In college, I was pre-med. Mm-hmm. So, I did everything a pre-med is supposed to do. You do the volunteering, you do the research, you get involved on campus. Obviously, the two most important things are your MCAT score and your grades. So personally, my MCAT score was not competitive enough to go into med school straight after college. And so it kind of like took me some time. However, like by the time I was going to graduate, I developed a passion for public health because I took an epidemiology class my senior year with my professor, Dr. Putzer, never forget him. I took a class with him, and I eventually became a TA. But in that class, like I learned, I never knew about like public health like at all. But I do know that growing up, one of my favorite quotes that my dad used to always say, it's in French, it says, "Prévenir vaut mieux que guérir," which means that it's better to prevent something than to heal something. So like that quote, I kind of like grew up with it, and I applied it to all my practices in life. So like discovering public health as a path, my senior year really helped me kind of like jump on it for a while. So before I graduated, I applied to a public health program, and I was like, you know what? So since I can't go to medical school right now, I'm gonna do something that I'm passionate about. And I'm gonna still work on it, but like I'm gonna work on this right now because I can do this right now. So I spent 2 years in the public health program, and I remember thinking to myself, okay, we're gonna do this, and if I feel like I'm content with becoming a public health practitioner, then maybe I'll give up on medical school. So I had that moment where I was like, if after I do this, I feel complete. I feel like this is my my path in life. I feel like this is enough because I can definitely apply public health to medicine as well if I go to medical school. So I told myself, this is what we're gonna do. So went through my public health classes for 2 years. I honestly felt like this was a good time for me to get to know myself more, because it wasn't like I was taking intense courses. I was taking very interesting courses. I was working in the ER, still exposing myself to medicine to see if I like it, which I loved. I love working in the ER. And I was working full-time as a scribe and also full-time student. And but I also felt like I had time to like discover who I am, just grow as a person. And then so towards the end, I was like, you know what? I still want to become a doctor. So I'm gonna do it. But I did have that moment where I almost gave up, thinking, maybe I don't want this, because it seemed like it was too hard, to try to pursue it. But I decided, no, we're gonna continue.
I think you mentioned something very important. I feel like a lot of pre-med students, one, when they choose an MPH program, they feel like, oh, it's just something to fill in the gap, yada, yada, yada. But they don't recognize that some people do it because they're passionate about it. It's not just like a gap year filler. You know what I'm saying? So that's the first thing that you mentioned.
Yeah.
Go ahead.
So, I mean, I agree with you, because I did get a lot of people reach out to me asking me, so what do you think about me doing this MPH program, like as a bridge to medical school? And I was like, first of all, if you're not interested in public health, do not do it. If your heart is not in it, don't do it, because it's not as much work as med school, but it still is a lot of work, and you have to be passionate about it to get through it, you know? And my public health program is actually what allowed me to figure out my path to the med school that I'm in right now, because the research that I did exposed me to what type of doctor I wanted to become, like what specialty I want to go into.
That's a great point. Like doing an MPH is not like a bridge that directly leads you to medicine. It's not like it's going to erase your science GPA or anything like that. So I want to go into the next step that you took, which was to do a master's program. So I want to know, what was your thought process when you moved from your MPH program to the master's program? Because you could have stopped there. You could have been like, you know what, I'm going to use my GPA from the MPH program and just like work from there. What was your thought process when you applied for that program?
Yeah, that's a good question. So my MPH GPA was very, very competitive. It was beautiful. And so like when I decided that I did want to go to med school still and to work with like my medicine degree and my public health degree, I realized, okay, so like, how am I going to do this? And it's interesting because this is how I feel like I'm meant to do this, because God kind of places these people in your path, you know what I'm talking about? So you actually were the one to introduce me to this master's program, because initially, like, you were telling me how you were interested in doing it, and I was kind of helping you on like how you could apply, and then I realized, wait a second, I want to do this too. And in that moment, I was trying to figure out what my next step was going to be to go to medical school. So like, it really felt like it was a divine intervention to place that in front of me. So, and then I figured, you know, like it's a master's of science, so that's definitely going to make my science GPA stronger. And it was also a bridge program where if you get a high enough GPA, then you can matriculate directly into their osteopathic program. However, if that doesn't work out, you can also apply to another medical school and matriculate into another medical school. So I think I realized with the MPH GPA, that would not be enough, because it's not only based on science, and I would also need an MCAT score. So, you know, like I realized this was the best thing for me to do.
Let's talk about the big elephant in the room, the MCAT. Sis, after your undergrad experience, did you retake the MCAT at some point?
I did not, actually. If you could define my journey in an interesting way, it will be trying to avoid the MCAT as much as possible. Because I did take the MCAT. I took the MCAT in 2015, and I believe this was literally the summer after they changed it to becoming from 4 hours to 7 hours long. And it's crazy because before that, I was practicing with the 4-hour practice test. So I literally took it as soon as it changed it to 7 hours. So it's not like there was enough material to work with, you know? And I'm not going to lie, like after I took that MCAT, my score wasn't competitive. But after that, like I kept studying to retake it, but I never retook it, if that makes sense. Like when I was in my public health program and working as a scribe, I kept scheduling the MCAT to take it, and I kept canceling it because something would come up, out family, you know, like I wouldn't have time to take it. So I'd have to like just push it back. But one thing I realized is that like, so when I was in school in Haiti, you know, I was doing really well. The MCAT is a standardized exam, you know, so like when you take it in the United States, a lot of people have been training, like I mentioned before, since high school, since college, to take this standardized exam. So they know how to take a standardized exam. Like when you're a person from another country and you're not used to those type of exams, it doesn't mean that you're not going to become a doctor, or you can't become a doctor. It just means that you were not exposed to that environment of standardized exam as long as other people have been. So yeah, that's the downside of the MCAT. Definitely. So yeah, I try my best to avoid it, and I survived.
So now after you went to undergrad, You did an MPH
Mm-hmm.
program. You did a master's program. Now, tell us, what path did you choose particularly? Let the public know what path you're in right now.
I can. So I think it's very interesting actually, because it wasn't just my public health experience that exposed me to that. It was also working in the ER, because when I worked in the ER, I was able to work with a lot of emergency medicine doctors, but I also got to work with a lot of podiatric podiatry doctors. So like one thing that really stood out to me when I worked in the ER, and that also is attached to me on a personal level, is the fact that, so my father, he's been living with diabetes since he was 30 years old, but he's like one of the best patients, to have that, because he's very disciplined. Like, he works out, he takes his medicine, he eats well. So it's like he knows how to maintain it in a very, very well. But like, diabetes is a disease that if you don't maintain it very well, you can end up having to get a foot amputation, or like you get ulcers, you get a lot of complications from that. So that's something that I was exposed to when I worked in the ER. We would see a lot of patients who wouldn't maintain their diabetes well. So they would end up having to get consults from podiatric surgeons all the time. So like, I got to work with them, and I was like, wow, like, why wasn't I exposed to this field before? Like, that's very cool, because my research in public health was about diabetes. And when I worked in the ER, it was probably most of the patients that we would see in the ER. So uh, being exposed to that in two different fields, like, opened me to the field of podiatry. So it's not something that I closed off. Like, and even throughout my master's program, I was jumping back and forth. I didn't know if I wanted to do emergency medicine. I didn't know if I wanted to do family medicine, because I love public health so much, and I love the idea of preventing things. And so like, I was never sure of what path I wanted to take. So after my master's program, I think I actually got an email from the school that I'm in right now, like, telling me, hey, you should come to this open house. Go to the open house. And I was like, you know what? I think this is the path for me. And I did the research, and I was like, I want to go to podiatry school. So I applied and prayed on it. And I was like, you know what? If this is for me, it will happen.
Yes,
And
I
the
love
rest is
that.
history.
I
I hope I answered your question.
Yes, you did. I think that you mentioned something very important here as well, and the fact that students don't realize that there are
Mm-hmm.
different paths in medicine. There are different things you can dabble into.
Definitely.
If it's not something, if you don't want to branch out, if you don't want to do PA, nursing, and things like that, you can look into like the different options that you have in medicine. And don't be closed off either, because there are people, after doing a post-bac program, they decide that maybe they want to do a PA program instead, and all of that. So I think that is beautiful that you kept it
Mm-hmm.
in mind, and you don't feel like it was a defeat or anything like that, but you saw it as an opportunity to continue on the path and to actually connect the interest that you have. I love that. So my next
Yes.
question is,
Beautifully said, actually.
yeah, my next question is about being burnt out. At this point, you did like 3 years into a master's program, like you had two different programs. So that's 3 years of gap year, if you would call it like that. And then you jumped right into podiatry
Mm-hmm.
school. So how do you avoid feeling burnt out? Because so far you haven't taken a break, sis.
I haven't. I've been in school my whole life, pretty much. That's interesting, because so through my public health program, I actually didn't feel burnt out often, because my public health classes, they were more about like coming up with like a plan, like writing a paper, doing a presentation. Like, I was enjoying all of these things. So in my public health program, I mean, actually, I did have to study for like a few, like epidemiology, biostats. I did have to study, but not as much as you have to in a science program. So like, I consider my 2 years in my public health like a fun 2 years. I was And I was working in the ER. I will say working in the ER was very tiring because I was working 12-hour shifts. At one point, I was working full time and in school. I don't know how I did that, but I enjoy working in the ER, and I enjoyed working in the public health program. So I don't think I got burnt out in the way that a medical student feels burnt out during those 2 years. I will, however, say, so the master's program after that, oh my God, that was the most I've ever studied in my life. It was just very, very competitive. It was a lot. I think I definitely got burnt out a few times that year. So, but I will say it was a very good program. It prepared me very well for medical school, and I'm happy I did it. And I'm also happy that, like, while I was kind of getting burnt out that year, there is a lot of resources or like people around me to pick me back up. Like, I wasn't alone. So I had like God to turn to. I had friends to turn to. I had physical exercise, eating healthy. Like, there's so many things that you have to be doing while you're studying hard, so that when you get burnt out, it's not like you're hitting rock bottom, something's picking you back up. So that year, my Master of Science year, that was definitely a year that I got burnt out a few times, where like, sometimes you just study so much, you have to know when to take a break. So I had to do that. But right now, I just started my second year of medical school, and I think my Master's of Science really gave me a foundation for med school, so that like the classes that I take now, I'm able to grasp the information very fast, and it's actually very interesting to me because I do love medicine. So you kind of realize, yes, I've been in medical school my whole life, but you have to love it. Just like public health, you have to love it. You have to love medicine because it's not an easy route to get to, but it's worth it if you really want to do it. If you're doing it for yourself and not for other people, you will really enjoy it. Right now, I'm at the point where I'm really enjoying what I'm learning, because I love science and I love learning about the human body and how it can heal itself, how you can heal it. And yeah.
I love it. Tell the people they need to take a break because
Take a break.
Facts. Okay. Now, the before last question is, what are some things that you wish you knew before you embarked into your pre-med or medical journey, and what advice would you give someone who's coming into that field?
Ooh, okay. So that's a good question as well. I think, so for me, I feel like there's a big difference. Like, what I'm gonna say, I don't know if it necessarily applies to me, but I will say something that I've noticed. A lot of people who go straight from college to medical school, I feel like once they graduate medical school, it's like, okay, what now? I mean, I have a job, I'm a doctor, but like, what do I do outside of that? And my sister, for example, like, she went straight from, because she went to school in medical school in Haiti. So she went straight from high school to medical school. And in Haiti, it's like at 18 years old, when you graduate high school, you go straight to medical school if you pass the test, and you spend the next 7 years of your life in medical school. And like, I also have a couple more friends who went straight into med school after college. And I'm not saying it's a bad thing at all. I'm not. But I will say that I do notice the difference between people who go straight into it and people who take a gap year or who take a break. I feel like you learn more about yourself when you have that time, and you also probably pick up a few more hobbies. And, just like, you're able to, I don't know how to say it. You're just able to grasp things better. You have more wisdom, because when you go to med school, you're just always thinking about studying. It's just always, everything is school, everything is your grades, everything is taking exams. And then once you're out of there and you're like an adult and you're thrown into like a residency somewhere, you have to figure out how to live a normal life after that. So when you take a gap year, I feel like you learn more about yourself, and you already know more about yourself before you go into medical school, where you have to focus on science all the time. Not all the time, but like most of the time.
But you
So
know what? What you said is actually a great tip to avoid feeling burnt out.
Yes.
Finding a hobby is very important during the medical journey because you have to find an escape outside of medical school so it doesn't consume you completely.
Yes.
So that's actually a very great point. And some people are able to find it even when they're in medical school. Some people work out and all of that. But also, another thing that you mentioned that's important is the self discovery process and knowing
Yeah.
yourself and knowing what you want outside of it. And that's not just doing something robotically, but having a process and having an intention behind it. I really like what you said. So
Thank
what is something
you.
you wish you knew yourself?
I honestly, I can't really think of something that I wish I knew. I feel like I'm going through this process and I'm not really regretting any of it. And I feel like I'm embracing everything that I'm going through, like with what I have. So I actually don't. There's nothing that can come to my mind about what I wish I knew.
That's beautiful.
But
That's okay. But what were you gonna say?
I was gonna ask you, what did you wish you knew?
Oh, girl. I wish I knew that being proactive is actually key for this journey because I had to learn a lot of things last minute, especially during
Okay.
the undergrad process. For me, I transferred after the 2 years. After the first 2 years of undergrad, I transferred to a 4 year institution. So I felt like I was trying to hit a goal back to back, but then I didn't have time to think of the bigger picture and my
Mhm.
Premed journey. I was just trying to check off some boxes. So I wish I knew that being proactive and starting to ask questions, starting to find mentors and things like that, that would have been helpful for my journey personally.
Okay.
But yeah, like you said, I feel like everything happens for a reason.
He's in.
So the way everything happened was beautiful for me also.
Yeah.
Uh,
Learned a lot.
yes, you live
I
and
don't have
learn.
I don't have regrets. I mean, I try to live my life without having regrets,
I love
you
it.
know.
Okay, so to close off, what is your favorite quote, girl?
My favorite quote. Can it be a verse?
It can be a verse. I
It could
love
be a
it.
verse.
Yes.
So I have like two verses that keep coming back up and that I feel like I apply to my life to go through everything I go through. And so like the first one is from John 1:5, and it says, "The light shines in the darkness, and the darkness can never extinguish it." Yeah. So that's the first one. And then the second one is from Matthew 5:14. It says, "You are the light of the world, like a city on the hilltop that cannot be hidden." So those I love the energy. Those two verses are like things that I carry with me everywhere I go. So like whenever I feel down, no matter what the situation, I always remember like you are a light. Like even if you're going through a moment of darkness right now, like you have so many obstacles, like you have all these like like just life happening to you, because not everything is going to be rainbows and butterflies. So you're going to go through hard times. You just have to remember you are the light. So no matter, even if you're in the darkness, you're still going to shine. You just have to keep putting the work in, keep trusting God, just keep going at it. Don't ever give up. Like I've had so many moments where I could have given up, like especially having such a longer journey to get to where I am. I had so many reasons to give up so many different times, but I never did because I tried to remember every time you're a light. You're a light in people's lives. You're a light in what you do. Keep putting your heart in everything you do so that no matter what darkness comes your way, you're still going to shine through it. So those are my favorite set of verses.
That's beautiful. That's beautiful. That's so funny because this morning I was thinking to myself the saying that says we're not buried, but we're planted.
Planted.
I feel like that's
Ooh.
also like, that's in the same concept. Also, it's like even in the darkness, you're a light. Keep pushing through. That's beautiful, man. I need to write that down. You need to give me these verses. Okay?
Honestly, I've used these verses so many times. Like you probably see me post them on my story. You probably see me post it like in a caption. It's probably my most overused verse because it just applies consistently every single time.
That's it. That's it. Well, Lettuce, thank you so much for coming. Where can we follow you, Lettuce?
Follow me on Instagram at lettuce_slay. Especially if you're pre-med. I mean, I feel like I'm not as like inspiring to pre-med students like Lisa is. Oh, Lisa Desires. I love her page. She's the best. But you know, whenever I post a glimpse about my life through medical school, you're free to catch it.
Yes. Actually, you get the T first. You get it here. I'm going to change my name, my IG name, to Lisa the Healer as well. I've been
I
trying
love it. Because you just be healing. You just be healing.
Yes. Okay. Maybe I should call the people the healing crew or something. Like, you'll find me for the gang. Okay. Thank
And
you
it's
so
interesting. Much. I like it because it's like it kind of reminds you, okay, you're gonna become a doctor. You're not just gonna heal your patients. You also have to heal in different ways. You have to heal the mind, heal the heart. I like it. Different dimensions.
Thank you. Thank you.